Is he confident that the interventions announced yesterday will be effective against the key environmental drivers of obesity, given that 1/3 of New Zealand children are overweight?
Speaker.
The Honourable Dr Jonathan Coleman.
Yes, I think that being virtually the only country with a national obesity target and a comprehensive evidence-based life course package for children with interventions across health, education, sport and food promotion, incorporating both targeted initiatives and broad-based population strategies, will be effective.
Supplementary.
Supplementary question, Kevin Haig.
Does he agree with Sir Peter Gluckman, who says, quote, "Children are the unwitting actors who become obese as a result of entrapment by contextual factors operating within society," end quote. And if he does, why is his policy package aimed more at individuals than these contextual factors?
The Honourable Dr. Jonathan Coleman.
Well, Mr Speaker, I speak with Peter Gluckman often, and I respect his advice, and he has had a lot of input into this package. And actually, it's not just about individuals here, it's about broad-based population strategies as well. There are 22 initiatives in here, 11 of them which are new. It's a comprehensive package. I would really welcome your support in going out and helping us promote this package, because you actually have a contribution to make, and the member knows that there's a lot of good elements to this package, including the health target, which is a signal achievement.
Supplementary, Mr Speaker.
Order. Supplementary question, Kevin Haig.
Why is the Minister not considering a fizzy drinks tax when the Prime Minister's own Chief Science Advisor, Sir Peter Gluckman, has strongly recommended one?
The Honourable Dr Jonathan Coleman.
He hasn't actually strongly recommended one. He says on balance he recommends one, but there actually isn't any evidence that a tax on sugary drinks would decrease obesity. University of Waikato is looking at the evidence. They'll have definitive evidence in 2017. I know the member would love to tax all sorts of things, but actually he needs to consider what would be the price elasticity of demand, how much would he want to put it up to. All I know is that if we have a Labor Greens government, the price of everything's going to go up, won't be just soft drinks.
Supplementary.
Supplementary question, Kevin Haig. Order. Kevin Haig, supplementary question.
Thank you, Mr Speaker. When a recent tax on fizzy drinks in Mexico has already decreased consumption by 12% in just 1 year, why is the government not even considering a fizzy drinks tax here?
The Honourable Dr Jonathan Coleman.
No, Mr Speaker, we did consider it, but there was no definitive evidence. If you look at Mexico, they've done all sorts of things there, which means that there may be a correlation, but there's no direct causation. They've had $30 billion invested in drinking water. They've had major problems with the economy. In short, there is no direct evidence that a soft drink tax will have an impact on obesity. So if he can show me the evidence, I'm happy to see it, but no one else has been able to.
Supplementary.
Supplementary question, Kevin Haig.
Will the Minister continue to be persuaded by the Food and Grocery Council when it comes to setting policy to improve the health of New Zealand's children? And if so, will the government's tobacco control measures now be based on advice from the tobacco industry?
Either of those two supplementary questions, the Honourable Dr Jonathan Coleman. Question number 9. Jacinda Ardern.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, does he agree with his colleague, the Honourable Anne Tolley's statement that children who need, quote, that instant hit of carbohydrates, a pie might not be a bad thing, and her subsequent decision to scrap healthy eating guidelines for schools in 2009?
Mr Speaker.
Order. The Honourable Dr Jonathan Coleman.
Yes, I think the decision was widely welcomed by schools at the time. It's important to note that the 2009 changes did not take away schools' responsibility
to promote... Order.
I can't hear the answer because of the level of interjection. Now, I've risen to my feet 2 or 3 occasions asking for some particular members to cease the loud interjections. I have no choice but to be asking members to leave the chamber. Would the Minister please start that answer again? I'd like to hear it.
Certainly. Yes, I think the decision was widely welcomed by schools at the time. It's important to note that the 2009 changes did not take away schools' responsibility to promote healthy foods and drinks to students. We're now building on this by expanding the Health Promoting Schools program to an extra 150 decile 1 to 4 primary and intermediate schools. And in addition, Aero will undertake a special review of food and nutrition and physical activity across the education system.
Supplementary.
Supplementary question, Jacinda Ardern.
Is he now contradicting himself, given that he said in 2005 that, quote, I can show you primary schools where kids have $1 pie for breakfast from the school tuck shop, then follow up with more of the same for lunch. That's what has to stop.
The Honourable Dr Jonathan Coleman.
Oh, I don't think there's any contradiction in what I said 10 years ago at all. But the point is, we're not going to be banning pies. We're going to be working with schools, with families, with communities to educate them that actually the odd pie now and then might not be a bad idea. There you go, that's yours.
Order. Order.
Don't be...
Order. I have not called the member yet, but all members have a right to ask the supplementary question. The Honourable Paula Bennett.
I think it's important. Don't be a pie hater. Come
Just
on.
ask the question then.
To the Minister, what was Mrs Tolley's full quote?
Apologise to the Minister. We have a point of order.
It's point of order because I seriously agree with you. I really want to hear this Minister's question.
Well then if the member stayed on his seat and listened, he'll hear it as much as I will. The Honourable Paula Bennett.
Thank you. I might know a thing about pies or two.
Order.
Right. What was Mrs Tolley's full quote on pies, and what other reports has he seen on pies recently?
The Honourable Dr Jonathan Coleman.
Mrs Tolley's full quote on pies was on Stuff on the 2nd of March 2009, and the full quote was, for the kid who's just been doing 2 hours of rugby practice and needs that instant hit of carbohydrates, a pie might not be a bad thing. I've received another report today in the New Zealand Herald saying, in quotes, if you're wondering what's been fueling the All Blacks' success in the Rugby World Cup, it's pies. The article goes on to say, and this is from the All Blacks, we have a dietitian. We love the pies, and it seems to be working for them. And I suggest to Andrew Little, if he's going to turn up in London and mix with them, he might not want to tell them he doesn't like their diet because they might think he's a bit of a wuss.
Supplementary.
Order. Order. Supplementary question. Order. Order. Supplementary question, Jacinda Ardern.
Supplementary. Is a target based on how many children are referred from a before-school check to a health professional for a lifestyle intervention really meaningful when A, more than 6,000 of the most high-needs children aren't accessing these checks in the first place, and B, we already know that referrals are being handed down for other serious medical conditions and not being followed up?
The Honourable Dr Jonathan Coleman.
No, the member's got it all wrong. So 92% of children are getting the before-school check. We've raised that radically from about 68% when Labor were in power. We're determined to triple the numbers. So at the moment, 1,400 children who are obese are being referred from those checks. We're going to triple that by December 2017 to 4,200. And no one can argue that that's not a good thing. It's been informed by expert advice. Pat Tui, consultant paediatrician, he thinks it's a great idea. Sir Peter Gluckman thinks it's a great idea. It's one part, I tell you, you've got no argument against.
Order. Supplementary question, Jacinda Ardern.
Why did he not set a child obesity target that actually included reducing the number of children who are obese?
The Honourable Dr Jonathan Coleman.
Look, we could have set all sorts of target. You know, the field was open. But what we took in the end was the expert advice. And I trust that advice over that member's advice any day of the week.
Not even a target on obesity.
Order.
Supplementary.
Supplementary question, Jacinda Ardern.
When did he consult the Children's Commissioner on this package, given his advocacy role and his position as a paediatrician? And was it as early as May when he began an official discussion with industry?
The Honourable Dr Jonathan Coleman.
I had my first lecture from the Children's Commissioner towards the end of last year, and then he came and saw me in my office probably around May. So I've had a full discussion with the Children's Commissioner and we've had a free exchange of views on this.